by Honorary Brigadier Dr. Arvind Lal, one of the most respected and influential voices in India's healthcare ecosystem.
So we had a very humble beginning with the first standalone lab with no collection centers established in 1949 by my late father, Dr. Major S.K. Lal. We serve nearly 3 crore patients annually with a menu of more than 5,000 tests and panels across 1,500 cities in India.
In your opinion, sir, how is primary care in India evolving?
You'd be surprised to know, Siddhartha, that today 65% of all deaths in India are caused by these NCDs, of which nearly half are caused by heart disease and heart attacks, hypertension, strokes, diabetes, and the remaining half are caused by all types of cancers, liver and kidney diseases, chronic lung disease, obesity, etc.
Hello and welcome to Health Unplugged. I'm Siddhartha Bhattacharya, Secretary General of NATHEALTH, and I'll be your host for today's conversation. Health Unplugged is a space where we step back from the headlines and policy papers to have honest, in-depth conversations with leaders who are shaping India's healthcare journey, sharing their experiences, perspectives, and the thinking behind the decisions that matter. One of the most important conversations in India's healthcare today is around primary care. It is the first point of contact for patients, the backbone of prevention and early diagnosis, and a critical pillar as we work towards the vision of an Arogya Bharat and a Viksit Bharat. To discuss this and much more, I am delighted to be joined by Honorary Brigadier Dr. Arvind Lal, one of the most respected and influential voices in India's healthcare ecosystem. Dr. Lal is the executive chairman of Dr. Lal PathLabs, India's oldest diagnostic company with a legacy of over 75 years. A Padma Shri awardee, Dr. Lal has been at the forefront of improving access, quality, and the trust in patient care. In recognition of his contributions, he was also conferred the honorary brigadier rank by the President of India in the Armed Forces Medical Services, the first civilian doctor to receive this honor. What also stands out in his deep commitment to primary health care. Through the Arvind Lal Vandana Lal Foundation, Dr. Lal has been working closely with the governments to strengthen healthcare delivery at the grassroots, especially in underserved communities. Dr. Lal, it's a pleasure to have you with us on Health Unplugged with NatHealth. It's a warm privilege to be with you, sir, in this momentous occasion. Thank you.
I've been associated with NatHealth ever since its inception, and it gives me great pleasure to be here once again today. Thank you very much.
We would really appreciate if you could illuminate us and start us off with a little bit of commentary on your background, your journey with Dr. Lal PathLabs, and more important, the motivation that drove you all along.
So we had a very humble beginning with the first standalone lab with no collection centers established in 1949 by my late father, Dr. Major S.K. Lal. Today, Dr. Lal PathLabs has become one of India's largest diagnostic chains with a legacy of over 75 years and a network of over 300 labs, 6,000 collection centers, 12,000 sample pickup points in hospitals, clinics, nursing homes, and other labs. We serve nearly 3 crore patients annually with a menu of more than 5,000 tests and panels across 1,500 cities in India. A few pivotal milestones transformed a single lab into Dr. Lal PathLabs, and in the process also helped bring about Indian diagnostics industry at par with global standards. First, we introduced the maximum number of tests and technologies for, I think, the first time in India, right from the thyroid and hepatitis B testing to introducing the lipid profile, bringing the first generation of semi-automated and fully automated analyzers. I also introduced the use of vacutainers for the first time in India, thereby improving the accuracy, safety, and quality of diagnostics in India. We have stayed abreast with cutting-edge diagnostic solutions, including advanced cancer genetics, and AI-enabled diagnostics. Secondly, Siddharth, we introduced franchising for the first time in healthcare in the world. This was done by opening franchisee operated collection centers and centralized labs for testing that ensured scale without compromising quality. The entire diagnostic industry is currently based on this model today. Further, our early digital transformation from developing India's first healthcare software in the form of what we call Lab Information Management System or LIMS to total lab automation, which enabled us to improve our turnaround time and also enhance quality and reliability. This was a significant achievement 40 years ago when quality and reliability in lab reports was unheard of. Finally, corporatization of our business with professional leadership and a successful IPO institutionalized the organization and helped ensure trust, sustainability, and nationwide growth.
In your opinion, sir, how is primary care in India evolving? A lot of us still go to the first point of interaction in healthcare is not with the primary care or the physician who is next door. What would be a good way for us to segregate or make citizens aware that the entry point into the healthcare system should be through primary care and not otherwise?
In my experience of nearly 5 decades, I have witnessed the transformation of diagnostics from being a support function to becoming the bedrock of modern medicine, and rightly so, because more than 70% of all clinical decisions are based on laboratory reports. During these years, India has undergone a significant shift in its disease burden from infectious diseases and maternal child deaths to non-communicable diseases or NCDs or what we call now lifestyle diseases. You'd be surprised to know, Siddharth, that today 65% of all deaths in India are caused by these NCDs, of which nearly half are caused by heart disease and heart attacks, hypertension, strokes, diabetes, and the remaining half are caused by all types of cancers, liver and kidney diseases, chronic lung disease, obesity, etc. In terms of prevalence, India is infamously called the diabetic capital of the world because we have 10 crore diabetics, 13 crore pre-diabetics who will eventually become diabetic, which means that there's a total complement of diabetics and pre-diabetics is about 23 crores. In addition, 31 crores of our population are hypertensive, that is having high blood pressure, which is a major cause for strokes in India. Further, 21 crore people have high cholesterol. So 25 crores are obese. In addition, we have more than 15 lakh diagnosed cases of various cancers, and therefore it is no surprise that 1 in every 4 Indians is suffering from one of the NCDs or lifestyle diseases that I have just mentioned. Also, nearly 15,000 people die due to these NCDs every day. So in terms of economic loss, we lose nearly 2% of our GDP each year due to these NCDs, and a study conducted by Bain and Company estimated that Indian economy will lose about $6 trillion US between 2012 and 2030 due to our inability to control these lifestyle diseases. In India, furthermore, NCDs strike almost 10 years earlier than other developed countries in the world. So that's a very big setback for us. But the good news is that 80% of the NCD deaths are preventable with lifestyle modification and early detection, which means we can save 12,000 of the 15,000 dying every day of NCDs. But government data shows stark gaps in screening for NCDs. What is really shocking is that the National Family Health Survey, or NFHS 5, indicated that nearly 50% of diabetics and more than 70% of hypertensive patients are undiagnosed, and less than 2% of women have been screened for cervical and breast cancers, and only 1.2% of men have been screened for oral cancer. So, Siddharth, there's a very stark gap between what we want and what the reality is. So, the biggest challenge with NCDs in India is that unless we screen the entire adult population, we cannot make early detection and treatment possible.
So, as you look at primary care as the foundational block towards health for all or universal health coverage, what could be the role of technology and the role at a community level where we have inadequate human resources, skilled human resources to be able to cover this physical gap and do it digitally?
Taking cognizance of the rising burden of NCDs, the Government of India, in its National Health Policy 2017, envisioned a shift from providing selective primary health care to comprehensive primary health care. In 2018, a more concrete step was taken with the announcement of creation of 1.5 lakh health and wellness centers or HWCs to deliver comprehensive primary health care. These are also called Arogya Mandirs. During the announcement, the government also invited the private sector in the form of NGOs, philanthropic organizations, and CSR practitioners to partner in these HWCs. The private sector rose to the occasion, and several partnerships have successfully fructified across the country. In 2020, my wife, Dr. Vandana Lal, and I started the ALVL Foundation or Arvind Lal Foundation. We were certain that to improve health outcomes in India, we must act at the primary healthcare level. And in primary healthcare, it is only the government that has the last mile reach. Therefore, leveraging the power of collaboration between the government and the private sector in 2021, the ALVL Foundation started a project with the government of Uttarakhand called Smart HWCs in Almora district, which was further extended to Pauri Garhwal district, in which we have over 70 HWCs partnering with us now. Further, in 2024, a similar project was started in UP under the aegis of FICCI in collaboration with NATHEALTH and OMAG, that is Organized Medical Academic Guild, bringing together for the first time leading private healthcare industry to work collaboratively with the state government for primary healthcare. I am happy to announce that now we have 30 partner HWCs under this project in Lucknow. With a health system strengthening approach, key interventions under the project include: number one, creating community awareness about the changing disease burden and rising burden of non-communicable diseases, including interactive activities like Nukkad Nataks in the local languages. Strengthening population level screening for non-communicable diseases with expanded menu of screening for tests and introducing tech-enabled screening solutions instead of manual subjective methods. For example, we have screened over 10,000 women for breast cancer using Niramai Thermalytics, which is an AI-enabled thermal screening device, and over 10,000 men and women have been screened for oral cancer using the oral scan device, which is a multimodal handheld device to screen the oral cavity to identify cancerous and pre-cancerous lesions. We have worked with the government to set up block public health labs for essential diagnosis and created a hub and spoke model wherein samples are collected at HWCs, transported by field staff to block level hub labs for testing, and reports are sent back electronically to the HWCs at the end of the day. The next intervention is training and capacity building and primary healthcare teams on the new services added to the scope of HWCs, under which we have trained over 800 healthcare workers across two states of UP and Uttarakhand. We have also achieved significant milestones in over 30 HWCs with Kayakalp and NCOS quality certifications, which are the NABH and NABL equivalent for government health facilities. The idea is to showcase these smart HWCs as pilot or demonstration models for the government to scale up and replicate in other parts of the country. Based on the success of these pilots in UP and Uttarakhand, we shall be happy to partner with governments in other parts of the country.
Lot of health financing in the country, lot of the money available for healthcare is even today going into curative and rehabilitative part of healthcare. How do we ensure that the incremental health resources that are envisaged under the national health policy, where India has decided to take up its spend from current 1.8% to 2.5% of the GDP, goes into preventive health and building robust primary care health systems?
It is to be noted that though India has 18% of world's population and 25% of the global disease burden, but it has only 2% of global spending on health. That is a very, very big problem. Also, Government of India's health spending is still less than 2% of a GDP, which includes spending on other non-health services like sanitation and drinking water. These are all included. And this is one of the areas where Government of India must start spending more money in order to arrest our rising disease burden, considering the fact that we are now the fourth largest economy in the world. I think we can afford to spend more money. To reinforce this point further, even WHO has stated that countries aiming for universal health coverage should spend at least 5% of their GDP on public health, where I just said that we spend even less than 2%. And though the Government of India has set a target of spending 2.5% of GDP on health by 2025, but the recently released economic survey indicates that we have missed this target also. Thus, India's health outcomes cannot improve meaningfully without a substantial rise in public health financing.
The recent budget announced the creation of over 1 lakh the allied healthcare professionals. Could they be designed in such a manner that we deploy them in the community towards fortifying the primary healthcare systems and build robust linkages between the preventive and the curative side of healthcare?
The Honorable Union Health Minister, Shri J.P. Nadda, has also said that India's healthcare transformation is not being constrained by lack of funds, but only by its efficient utilization. He has reassured us many times that there is no dearth of additional funds that can be allocated for health, provided the additional funding translates into better health outcomes. Therefore, the most crucial need of the country right now is to invest in mass-scale screening for NCDs, to find out the actual burden of NCDs and catch them early to prevent complications, hospitalizations, and mortality. The next is that the early screening for NCDs will help the saving of up to 2% of our GDP annually. And in my opinion, this is a no-brainer and it should be done forthwith. In addition to the increased government spending, we need to think of innovative sources of funding mass-scale screening of NCDs. For example, the time has come for government to allow diagnostic companies like ours to channelize the CSR funds for mass-scale screening, which is currently prohibited, as a company cannot undertake CSR in its so-called core area of business. Additionally, the government should start utilizing the 4% cess for health and education that is being collected to carry out NCD screening. Currently, only 25% of this amount is channelized towards health. And finally, about the sin tax, sin tax, which was introduced in September 2025 with the imposition of 40% GST on items harmful to health, such as tobacco, pan masala, sugary, aerated drinks, etc. So my strong suggestion is that the sin tax collected should be plowed back into tackling NCDs, considering their extreme impact on India's growth and development.
Newspapers You would have seen some examples of someone who has unfortunately at a very young age passed away, had no previous complications, and unfortunately with NCDs. Often in India, we don't believe that we have to see a doctor till we are grossly ill or we are feeling sick. What is the role of diagnostics in being able to pick up early signs of non-communicable diseases so that we are able to control them and we are able to live a long and a healthy life?
Diagnostic sector can play an important role in mass scale screening. Let us take the example of COVID-19 pandemic, where test, track and control or test, track and treat became the mantra across the world. The first step in the mantra is test, without which right healthcare response cannot be begun. Just the way we tackled the COVID pandemic on a war footing by aggressively screening for COVID, in a similar manner, we must attack this new pandemic of NCDs by screening all adults with early markers for common NCDs, that is, blood sugar for diabetes, cholesterol for heart disease, SGPT for liver, creatinine for kidneys, and hemoglobin for anemia that is so prevalent in our women here. And then introducing tech-enabled devices for screening of cancers instead of manual and subjective methods of screening. For example, thermal screening for breast cancer, AI-enabled X-rays for lung cancer and TB, handheld optical devices for oral and cervical cancers, etc., which have all been successfully tested in the field. So this has to be taken up in a mission mode on a war footing. We will need all hands on deck, and therefore the private diagnostics providers should also be roped in to carry out such mass scale screening as was massively done during COVID. So the government of India has done it before and they can involve the private parties again. During the recently concluded Shanghai Cooperation meeting or Shanghai Cooperation Organization meet in Beijing, the Chinese President Xi Jinping and the Russian President Vladimir Putin spoke about the possibility of humans living up to 150 years. See, our bosses, leaders have also already started saying that, citing advancements in biotechnology and medical science. And therefore, the least India can do is to eliminate the untimely deaths of young adults in their 30s and 40s. They are talking about 150, we are talking about 30s and 40s, and who are dying due to NCDs, and with mass scale early detection screening program. So Siddharth, in my opinion, this should start forthwith. So Siddharth, many times this thought comes to us that what can we do about, healthcare in this country? The government itself has got many schemes, they're at it. We in NATHEALTH have also done a lot of things. But what it seems, likely is that since we have such a huge burden of non-communicable diseases, and for the sake of laymen, non-communicable diseases are consisting of diabetes, high blood pressure, liver disease, kidney disease, and things like that. So what I am saying is that there is not enough testing which is being done in India. Not because I am from the testing line, but we have a huge burden of diabetics who don't know that they are diabetics. And the numbers are humongous, 20 crores, 23 crores, things like that. So people have to be screened. So we have to devise ways and means where we can get these people to come out, and when we are taking their blood, we can take their blood for blood sugar, for cholesterol, we can even take for ladies for hemoglobin, one test for kidney which is creatinine, maybe one for liver test that is SGPT or so. So I think we have come of age, and unless we detect, we cannot track and we cannot treat. So I think detection, like it was Government of India's policy only during the time when the COVID epidemic was in full swing. It was again test, track, and treat. So NCD is a bigger problem which is not going to go away if we don't look at it. So I think we should do something as private healthcare providers, NATHEALTH and other, such organizations. I think we should put forth kind of a program to the government where we can, help out the government in this task.
Dear Dr. Lal sir, you have been an invaluable part of NATHEALTH, one of the founding members of NATHEALTH. It has been a deeply enriching conversation today. Your vision on primary care is truly illuminating, and we look forward to working with the entire ecosystem represented by NATHEALTH to build a powerful coalition and a movement where no one is left behind, no matter where, no matter what their age. Thank you immensely for your time.
Thank you, Siddharth, for getting me here and letting me hear also your views on primary health care. I think this can go a very long way.